All right, so what we've got here are a couple of fresh pig hearts, which of course we know are very good surrogates or fill-ins for a mammalian heart. And if we estimate the size of the heart to be about the size of a person's fist, you can see these are from pigs that would be about the size of a human. And I'm just going to treat them from here on out as if they're human hearts. There's really not much to differentiate them in that regard. We're looking down at the ventral surface as if we've opened up the chest cavity, and we're looking down ventrally. And this is where I like to be able to the, focus in or sort of get oriented by seeing what we call the interventricular surface, separating the two ventricles, so named because they're mostly on the ventral surface. The left ventricle, the much larger one, which pumps blood obviously to the systemic circulation and incorporates the apex or the pointed part of the heart from the right ventricle over here. If we trace the flow of blood, and then you can really nicely see the right ventricle with the blood going straight out the big pulmonary trunk that comes off again superficially on the ventral surface and then would separate to the left and right pulmonary arteries, taking blood to the lungs, out to the capillaries. That blood would then come back to the left atrium. I can see this part of the atrium, what's called the auricle here on the ventral surface, but the pulmonary veins come in on the back of the atrium where I can see these entries here for pulmonary veins. Then the blood would go from the left atrium into the left ventricle and then out the big dorsal aorta that comes off behind the pulmonary trunk. Here's where I can see the dorsal aorta with some of those vessels that go to the head and the upper limbs, carotid and subclavian arteries, and then that dorsal aorta would arch back dorsally and become the the aortic arch would arch back and become the dorsal aorta, going down inferiorly to the abdomen and the legs and all the rest of the body. Out to the capillaries of all of the body, the blood would come back then to the right atrium. I can see this part of the right atrium, the auricle here, and if I look back here, I can maybe see some entry for not much. I'll show you on the other heart. I can see the right atrium back here with nice entries for the inferior and superior vena cava that come into the right atrium. We'll go back to our other heart now. From the right atrium, the blood goes into the right ventricle, and of course right back out the pulmonary trunk to the lungs. Now what I can also see really nicely, that's what I can see superficially on the heart. If I cut into the chambers, I cut into the left ventricle, and I can nicely see I've cut straight from the left ventricle up into the left atrium here, and I can see what are the cusps of the bicuspid valve which guard that entrance from the atrium into the ventricle. When the atrium pumps blood through there, the cusps, or these very flimsy flaps of tissue, lay against the ventricle, and the blood flows right through. But when the ventricle contracts, pushing blood out the dorsal aorta, in order for the blood not to go back up into the atrium, the two cusps snap together, these chordae tendinae, what are called tendinous cords, that's what it translates to, attached to these papillary muscles on the wall of the ventricle. They snap together, they don't get blown back into the atrium because of the chordae tendinae, and they make that lub sound. And of course, we see it on both sides. You can kind of see the atrioventricular valves here on the right ventricle, but it's easier to see on the left side. And when the two atrioventricular valves come together as the ventricles contract in unison, it makes that lub sound. And that pushes the blood, instead of into the atria, into the pulmonary trunk on the right side and the aorta on the left side. Now, I'm going to switch over to the other heart to show you the semilunar valves. So the atrioventricular valves snap shut at systole, making the lub sound. When the ventricles relax in diastole, that's when the blood would naturally tend to just come right back into the relaxing, almost opening ventricles from the pulmonary trunk and from the aorta, but they have what we call the semilunar valves that keep the blood from coming back into the ventricles, and they make the dub sound in diastole. Here you can see the semilunar valves are these half-moon shaped, therefore the name semilunar, flaps of tissue around the exit, in this case of the pulmonary trunk. So there's the right ventricle going out the pulmonary trunk, and there's those little flaps, and the way they work is as the blood tends to come back down into the ventricle, the flaps fill with blood, they form like a little pocket full of blood, and the three flaps all come together in the center of the pulmonary trunk and keep the blood coming back in. They're the exact same valves we see in the veins to prevent backflow. I have one other view I think you'll really like. That's the flaps of the semilunar valve, or the pulmonary valve in the pulmonary trunk. But if we look in from the top, This is the aorta on this heart. So here's where the left ventricle, I'll even show this to you, the left ventricle, when it contracts, is going to push blood. Remember, it's not going to push the blood back into the atrium. It's going to push the blood back through, out the aorta. So there you can see where I'm going from the ventricle out the aorta. And if I look in from the top, I can kind of see, actually I can clearly see the flaps of the aortic semilunar valve, and you can even see how they would come together like that and form a seal inside the aorta. Hopefully you can get a decent view of that inside there. Okay. I also have a photo of it that'll be on the website. So that's what we see. Just a really quick review. I've got, from the ventral view, the interventricular sulcus separating the left ventricle that incorporates the apex from the right ventricle. Inside, just to trace the flow of blood, right ventricle, out the pulmonary artery to the lungs, back to the left atrium where I can see the pulmonary veins coming into the left atrium to the left ventricle, out the big dorsal aorta, back behind the pulmonary trunk, to all the systems of the body, back to the right atrium, to the right ventricle, and then back to the lungs. When I look inside the left atrium here, I can nicely see an atrioventricular valve that prevents backflow into the atrium when the ventricles go into systole or pump the blood out the aorta, and also the same thing on the right side out the pulmonary trunk. And then to prevent backflow into the ventricles when the ventricles relax in diastole, I have these nice semilunar valves. A pulmonary one around the pulmonary trunk, and the same thing, an aortic valve around the aorta. And that's a nice view of a fresh pig heart.